Welcome back to Therapy Uncensored. I'm Ellie, a licensed mental health counselor and doctorate student in counseling education. Today I want to talk about ketamine. I've done about 15 rounds of ketamine, and honestly, it is one of the best decisions I've made. And I'm going to tell you why. And I want to demystify it. It's not as scary as it sounds, but I want to honor that, yeah, it can seem scary. That's because we haven't done a lot of education around it, and that's because it's a taboo topic, hence why it's a perfect fit for this channel. Ketamine can be used in different ways for chronic pain and mental health. A chronic pain dose is going to be very different than a mental health dose, so I'm really just going to focus on the mental health side of things today. Why does ketamine work for mental health? Oftentimes, our ego doesn't want us to get better. It's hard to move beyond, it's hard to create change. This is going to help you create change. This is going to help you restore the physiological part of your brain that stresses damage so much so that you can go forth and do the work that's important. And why do the work? Why not just live this way forever? Because we know it leads to so many worse things: chronic pain, anxiety, diseases. We know the sooner you do this, the better. Do this for yourself, whether it's therapy or ketamine or what. How do you know if you're a good candidate for ketamine? Well, I don't think just like anyone off the street should be doing ketamine. For example, I knew it was the next step for me because I have been in therapy 5 years and I've made a lot of strides in a lot of ways, but I still have very severe PTSD, actually CPTSD, which is complex post traumatic stress disorder, which it's like PTSD times 100. So I knew it was time for me to like switch up the system, try something else. I had done, EMDR, I had done ISTDP, which is the chronic pain therapy I do on other people now. Um, and I just was like, I needed to try something else. So when I moved into my office here, the nurse practitioners started doing ketamine, and it seemed like a universal divine intervention that, yeah, I'm meant to be here and I'm meant to do ketamine. Also, any good practitioner before recommending it will do it themselves. So it cracks me up when like clients come in and they're like, "Do you know what ketamine is?" And I'm like, "Yeah, done it 15 times." Yeah. Ketamine first started being used in military combat around the 1960s. This is because it has a dissociative anesthetic effect, but it does not affect the respiratory system, making it a great drug for when they were out there in war. Ketamine affects your NMDA receptors, and it also helps restore neural pathways that have been damaged from stress. We all have stress, all to different degrees, that we've experienced throughout our life. Neural connections sometimes break or get damaged in our brain through stress. A client once asked me, "Can you take a scrub daddy, those like sponges, to my brain?" And I thought, wow, that's like a really good way to describe what ketamine does. It just takes those layers of grime that have been on there for so long. Think of like when you cook sauce and the bottom gets really burned sometimes and gross and you have to like let it sit in the sink. Ketamine is that really good soap mixture that you put in there that starts like loosening things up. It's like, okay, we can bring this to the surface. We can clean this. We can clean ourselves. That's what ketamine is. Ketamine is going to help you get to the surface so that you can do the work. Sometimes things are just too dark, too overwhelming. It's hard for people to come into therapy. This can help you get to the point where you can come in and do the work. So much research has shown ketamine to be effective for OCD, anxiety, trauma, depression, and addictions. This is because, again, it's changing and restoring your neural pathways. The really cool thing about ketamine is a lot of people, a lot of athletes, especially who have had concussion syndromes, it is shown to reverse the effects and I've seen it firsthand. It's really, really cool. So, again, if you've had multiple concussions, this is something really to consider. And you just want to go with the music, wherever the music takes you. It's going to take you to some wild places. Some people have more of a visual experience, some people have more of a feeling experience. So, for example, my husband is a very black and white person. I'm a very colorful, like the world, like there's no black and white, right? Because I'm so spiritual to begin with, when I began my treatments, and still, I don't have as much of that visual hallucinogenic effect. I just feel it. I can feel spirits or feelings or whatever it is around me. My husband, however, he needs a lot more convincing than I do. It's kind of like Santa Claus, right? Like he needs to see Santa Claus to know he's real. I just know he's real. So, for my husband, he would get a lot more of like the visual type of stuff going on. We also were doing it for two very different reasons. My husband was doing it for depression. I'm doing it for PTSD. So it depends what you're doing it for as well. And everyone's going to have an individualized experience. I will also say that I had done 5 years of therapy consecutively, religiously, every week for 5 years going into my ketamine experience. Someone who's never gone to therapy and is doing ketamine for the first time, this might really open Pandora's box for you. You might have some things come to the surface that you're like, oof, I do not want to deal with that. What ketamine is going to help you do, though, is help restore those damaged neural pathways into a place where you can hopefully then do the hard work that is inside of Pandora's box. It's possible your heart rate might increase a little bit at the beginning, but it tends to even out as the ketamine treatment goes on. Your vitals are taken beforehand and after to make sure that everything is all good. The other wonderful thing about this is it's such a fast acting and fast releasing drug. So, for example, one time I had to get up to go to the bathroom in the middle of a ketamine treatment, which was a mess because I was high as a kite and I had to go to the bathroom. This was like a bad situation all around because getting up too fast made me nauseous and blah, blah, blah. I won't go into all the logistics. But basically, the nurse practitioner pulled it out, and within 15 minutes, you're like back to. I was still very nauseous because of like the physics of it all. And normally, you don't have to go to the bathroom during a ketamine treatment, it's just me and my bladder. But the physics of it all, I was still nauseous, but like the high feeling was out within like 15 minutes. So that's also another wonderful thing that if you're having like a so-called bad trip, they come in, they pull it, and you're back to reality pretty quick. Speaking of trips, we hear about bad trips and whatnot, and I want to emphasize that there's not really a bad trip per se. The starter dose is so small that it's not going to put you in a K-hole like you hear about. It's not going to give you a bad trip. You might not even trip at all first time, but you might. Might be cool, might be fun. But the point is, like, you just go where it takes you. It's not meant to, like, necessarily be this cool, fun experience, although I personally do find it enjoyable. It's like, takes the edge off, and you get to think about some lovely thoughts for 45 minutes. And time kind of goes away. Like, you don't realize what time it is. You're just kind of in there, like, vibing, enjoying life. People know it as a horse tranquilizer, and you're not getting that level. You're not even getting close to that amount. I know people that did ketamine recreationally in college. Again, you're not even getting close to that amount. Everyone's amount of ketamine they need is going to be different. Usually, you do about 5 rounds to begin with, see how you do. Also depends what you're treating. My issues go back to being when I was born, basically. So, yeah, I'm going to need a lot more ketamine than someone who had a traumatic experience just a week ago and it's fresh in their brain. So, if you take ketamine orally, it's going to attach to about 20% of your neuroreceptors. If you do an IV drip, it's going to attach to about 80%. Would you rather have the 20 or the 80? I'd rather have the 80. Because also, I'm not going to sugarcoat it, ketamine's expensive. I believe for a package of 5 at our facility, it's a little over 1,500. So just think IVs are so much easier to monitor. We do it here in such a safe, controlled setting. It scares me that it's even an option out there that they will just ship ketamine to someone's home and have them go on a ketamine trip by themselves. That's dangerous. I would not recommend that. I think that's really poor mental health, and ethical practice. Do insurance companies cover it? I have yet to see one that does, at least for mental health. But if you find one, please let me know because I would love to learn about it. So, when you go into a ketamine session, you're gonna get your IV hooked up. You're gonna get some Zofran if you tend to get nauseous like me. Everything makes me nauseous, so I do it preventatively. And it'll take probably 6 to 10 minutes for it to kick in. I know it's starting to kick in when I feel like my legs are kind of floating or my teeth kind of start feeling funky. Not funky in a bad way, just in like sort of that dissociative type of way. So you follow the music, you go wherever their mind takes you with the music. I have had all sorts of different thoughts, experiences, and honestly, for me personally, I don't remember them most of the time after. But I know, especially in my first round of treatments, it was like really impactful. And as you go on, um, there's different stages. Okay, phase 1 of ketamine, treatments 1 through 5. This is going to help your neurotransmitters reset. There's an increase in somatic transmission and an increased state of mental energy. The whole overarching goal of treatments 1 through 5 is hope and perspective. Phase 2, treatments 5 through 10, gratitude, motivation, and ambition. You start to understand the importance of a lifestyle. You start to understand that even the small changes make a big change. You're going to start to walk that path towards that life that you truly want to live. Phase 3, we call cruise control. This is 10 treatments on. You're on autopilot and you're just going. You know what's good for you. You're thinking new. You're doing a new lifestyle. You're not going back. You're trying to move forward. After 10 treatments, research shows us that people become more motivated. It's greatly helpful in mood disorders. People become more optimistic. They become more outgoing. People who have avoided feeling pleasure, consciously or not, start to feel pleasure again. This is especially true for depression patients. In other words, you can start to see the light. You can start to see that life is worth living again. Because man, does trauma and stress dull our light and just makes it smaller and smaller and smaller. And just like, what's this all for, right? We can easily get to that state. This helps you see the light again. Some considerations for going into ketamine treatment. You're going to want to stop taking any benzos or any sort of stimulants about a day before the treatment, which you will get a whole list of instructions from our office if you do it here. But you're going to want to stop those as they can affect the treatment. You're not going to want to drink or eat 2 hours before. You might get the Zofran for nausea, like I said. And you're also, if you do it here, going to get a squeeze ball to help you do something with your hands when you're in there. Because you get a little like, at least I do, but you can tell I talk with my hands a lot and I'm ADHD, like I said. So, like, I need to like squeeze that guy when I'm in there. So, a squeeze ball and an eye mask so that you can like totally tune out, and some nice Bose headphones that you can like really tune into the music. Also, our ketamine rooms are soundproof, so it's you in that room. The beauty is, though, that our nurse practitioners are literally on the other side of the wall. So you also are going to get a call button that's going to go right in your hand, and it has a strap so you can't lose it. And yes, you dissociate, but you're with it enough to know to do those things. So if something were to come up, you can hit the button. Like I said with my bathroom incident, like I had to hit the button, but I knew enough to hit the button. And I was really out of it, like, because you're in a different realm, for lack of a better word. Well, not even lack of a better word, you really are in a different realm. And that, like, I was still able to do that, and they are there like that. I mean, in like a split second, they're in the door, like, what's up? How can we help? Even if like sometimes people don't like the music. Like last week I tried a new track and I was like, this is like way too uppity for me right now. And yeah, like hit the button, changed the music, and like all was good. So it's very supportive environment here. Very, very, very supportive. You also, another thing to mention is you can't drive for 2 hours after. So you either need someone to come with you or you need to wait 2 hours in our office or whatever office you go to let it, play itself out and it's safe for you to drive home. Also, I'm a huge reality TV fan, and I know that ketamine is especially really talked about on the Secret Lives of Mormon Wives right now, which is awesome. I'm so glad they're spreading the word. The one thing I will say about their treatments, I believe it was Jen and Zach went together in the same room. I would not recommend that, and we would not do that here. It's a very individual, personalized experience. You want it just by yourself. And I remember even in the scene, they were kind of talking, and then once it started kicking in, they put their eye masks on. That would not happen here. You're going like eye mask on to begin with, let the music take you where you need to be. Think of an intention, like you do every session, you'll set an intention, and think of like a happy thought going into it. You might also want to bring some personal items. I like to bring my heating pad to be cozy. I like to bring my rosary. I like to bring a few crystals, essential oils, and I also bring a list of things I'm grateful for, a gratitude list, and I put it under the pillow just to be there in the room with me. And I can honestly say here at What the Wellness Healing Center, the office that Lumina is located inside my practice, they are so wonderful at this. They are so well trained. It's a mother daughter duo, Tia and Tara, and they are both licensed nurse practitioners and really know what they're doing with this stuff. They're ahead of the curve in preventative medicine and also in just in new medicine in this nuanced type of field that we're learning about, but they've been trained in and they know what they're doing. So they're also lovely people, and I'm not saying that they don't pay me. They have I've no I get nothing out of saying this, but I think they will make you feel at home if you choose to do it in your office. And that's really the goal of our whole healing center is we want you to feel at home here. And it's wonderful to do it here where you get to wake up in a nice cozy room that looks like a bedroom rather than waking up in a hospital with like those yucky curtains and the uncomfortable beds. Like we have weighted blankets, we have essential oils in there if you want them, the lights dim. So it's like a vibe. Like it's really honestly very comfortable in there. And I just want to emphasize again that I am not a medical provider, I'm a mental health practitioner, although I specialize in integrated care. So please note that the physiological part of all of this and the biological part and all that stuff, you're going to really want to talk it through with a licensed medical provider, like someone at our office or elsewhere. But I can really speak to the mental health side of things. If you're unsure if this is a good fit for you, think about, have you been in a stuck place for, years? Has this been a lifelong struggle? Has nothing else really helped? Those are questions you're going to want to consider. And when I say nothing else has really helped, I mean really nothing else has helped. So, for example, like I said, I did all sorts of therapy for years and it's helped, but not to the degree I needed it to help. So I need you to really think this through. And if you've never tried therapy, I would start with therapy before you just dive right into ketamine. Start with the therapy, see if that does anything, see if that stirs up some things that might be helpful. And if you just can't get there, then yeah, ketamine might be a great option. But you don't need to dive into the ketamine right away. So really be honest with yourself. And also, I want to say that like people do contact our office that are addicts and try to get this, and there's a screening process. So don't even think you're going to be getting in this building in that room if you're just trying to do it for fun. If you're not taking it seriously, we take this very, very seriously here. This is not some sort of fun drug for us. um yeah, it is kind of fun when you're under, but it's not recreational. It is very serious for healing purposes, and it's just frankly disrespectful to our environment to come in here thinking anything else. So If you come here or have any questions, if you have any questions about ketamine, please comment below. Please subscribe to our channel. We're going to be covering new topics every week. I will probably circle back to ketamine at some point. I'd love to get one of our providers on here to talk a little bit more about it. And please reach out to my website and bio if you are interested in scheduling a session. And I look forward to seeing you again.